Earlier in the week, the legislature extended that emergency declaration to the end of the month. The governor wanted another 70 days. We talked with State Senator Rick Outman about the experience of being tested for a fever and putting on masks to go into the chamber to cast that vote.
Well, certainly different. I mean, it wasn't the hugs and the handshakes and everything that you would figure on having after, an absence of any certain amount of time. But it was a safe process. We were screened before we went over to the Capitol building. They took our temperatures, asked some screening questions, requested that we wore face masks. It wasn't mandatory, but most everyone complied. And of course, social distancing. And it was a very limited amount of time. We were just there. We did what we had to do and got out of there. I'll bet it wasn't a matter of 10 minutes. So, it was probably safer than going to the grocery store, but something we felt was necessary.
Well, one of the things that was important to do from the standpoint of the legislature was to weigh in on the expansion of the emergency declaration. The governor had asked for 70 days. You and the legislature decided through the end of the month. Tell me about the process of coming to that decision, because obviously there were a lot of different points of view. And by the way, there were some people who wanted to do it even shorter than till the end of the month.
It was certainly a compromise between those that wanted the shortest amount and the governor who wanted 70 days. We felt that a blanket 70 days was really sending the wrong message to the public that we were going to be locked down, even though she has the ability to lift it anytime during those 70 days. We think it needs to be in shorter durations. As this pandemic continues to evolve, things happen overnight, and we know that things can correct themselves overnight too. And there's certainly a lot of speculation on whether we should have a blanket shutdown anyway. So we thought we needed to weigh in and express our concerns.
Let's talk a little bit about what the state has already done. There has been a significant amount of money that has been dedicated towards fighting this pandemic. Do you anticipate, with the loss of revenue the state is going to have and with the continuing needs, that you and the legislature are going to have to do more on the economic side when it comes to this crisis?
Well, we're certainly looking at what comes to the state via the federal stimulus package, how much of that money goes to us directly, how much of it goes to hospitals and other COVID response teams. And so as we wade through that, that'll determine how much more money that we have to put forward in a supplemental. But certainly we're looking at negative supplementals because I think the projections that I have or that I've seen is for our 2020 budget alone, it's going to be anywhere from a $1 to $3 billion deficit. And for our 2021 budget, anywhere from a $1 to $4 billion deficit. So worst case scenario, we could be a $7 billion deficit budget. So a lot of that is based on our January revenue estimating conference. Of course, we have another one in May. We would have some firmer numbers in May had we not extended the filing deadline to July 15th. We would know a lot more. A lot of it's going to be based on projections now, and so much of it is based on how long this shutdown lasts. But we're certainly working on it, and I'm involved on the DHHS approach committee, and we have probably every other day committee meetings via Zoom, or not committee meetings, but work groups, just going through the budget.
Well, and DHHS is such a substantial part of the budget. That's where the pressure will be for spending and also for financing. So, I mean, how difficult is it going to be to put that big budget together, even understanding that a lot of that is federal?
We had a lot of hopes for, as our revenues were continuing to increase with the good economy that we had a lot of hopes for restoring or even improving some programs, and it looks like we're probably going to go backwards on a lot of it. But, again, a lot of it's based, and we're just working through it.
At the state level, the emergency declaration and the stay-at-home order have both been extended. So what's next?